Assemble the equipment. Insert the needle into the adapter. If needed, refer to the manufacturer's instructions. Following the standard order of draw, select the correct evacuated collection tube. Read the expiration date on the tube to make sure the additives have not expired. Push the rubber stopper of the collection tube onto the short end of the needle just enough to hold it in place. Do not push the tube onto the needle the whole way. If the tube is pressed completely onto the needle, blood will rush in the tube as soon as the needle is inserted into the vein.
Select a vein. Apply the tourniquet around the patient's upper arm about 3 or 4 inches from the bend in the elbow. Tie or fasten the Velcro on the tourniquet firmly, but not too tightly. You do not want to cut off the circulation completely. Remember that the tourniquet can only be applied for 1 minute, so the following steps must be performed in a timely manner. Select a vein for the puncture. Tap the antecubital space. Trace the veins with your fingers. Feel for a spongy vein and make sure it rolls slightly beneath your fingers. If you cannot find a vein, ask the patient to make a fist. Cleanse the skin over the vein you have selected. Allow the area to air dry. Do not blow on the area because you may contaminate it. Insert the needle. Remove the needle cover. Insert the needle into the vein. Grasp the patient's arm with your hand and use your thumb to hold the skin taut about 2 inches below the puncture site. Use a gentle, steady motion to insert the needle into the vein at about a 15-degree angle to the skin. The angle may be bigger or smaller, depending on the depth of the patient's vein. Make sure that the bevel or opening of the needle is facing up. Follow the path of the vein when inserting the needle. Avoid probing beneath the skin and puncturing through the far side of the vein. This may cause a hematoma. If you cannot find the vein within 1 minute, then you should stop and release the tourniquet. Wait for 2 minutes before restarting.